All right. Well, hello everyone. Welcome. Happy Wednesday. So glad to be here again to have this conversation. We have an amazing person who we're bringing back, the wonderful Dr. Jess. And we're going to talk about how to glow up in our or perimenopause stage. So we're so excited. Dr. Jess, thank you again for being here with us. How are you feeling today?
Thank you so much. I am honored as always to be a guest on this webinar, and I'm very excited, very passionate about this topic in particular. So I'm really excited to share all the info with you guys today.
Good. Good. We're excited to receive it for sure. So for everyone who's new to this platform, this is our Inspire and Build webinar and chat. So Inspire and Build a little more about that. This actually comes from our DivaDance values of inspiring confidence and building community. So with Inspire and Build, we focus on ways that our community can thrive beyond the dance floor and outside of the dance studio. So if you want to learn more about some of the things that we're doing and how we can focus on those, here's some ways that you can find us. You can either go to our Inspire and Build broadcast channel. The way you can find that is go to our Diva Dance headquarters page and then join. You'll be able to keep up with all the latest things that we have going on, some polls, some interactive opportunities, as well as you can keep up with our emails and newsletters. And if you want to see our website just to see what other updates are happening, you can always go to divadanceinspireandbuild.com. And Elizabeth has placed the IMB broadcast channel in our chat, so you'll be able to join right now. So before we get started, we want to give homage to who has really helped us to push forward this platform and making sure that we support people. So we want to shout out our partnership with Hers. Hers is a mental health platform that is not a one size fit all situation, and it informs of how medication is not a dirty word. In fact, sometimes that is exactly what we need. So hers connects you with licensed providers who personalize a treatment plan that works for you, from anxiety and burnout to that can't get out of bed type of fatigue. No insurance, no waiting rooms, no fluff. Just real support and FDA approved treatment 100% online. So if you feel like you're hearing this message and you're ready to take a small but powerful step towards this, then go to divadanceInspireandBuild.com and follow the link for a free mental health assessment. It could be the beginning of you feeling like yourself again. So, again, thank you to Hers for our partnership and for the sponsorship for this platform. All right, well, let's go into our topic for today. I think this is going to be really exciting to talk about, especially in such a positive, empowering, and educational space. So, thinking about this process of perimenopause and even going into menopause, and thinking about, well, first, what is it? What's going on with our bodies? And how can we feel empowered and educated to walk through it confidently? And not feel like it's the end of the world, but feel like it's the beginning of something new and something great. And there's no one better that we could have brought back than Dr. Jess. If you remember, she helped us before with the first cycle of life of talking about those well woman exams and talking about our cycles and preparing for childbearing if that's open to you. And so now we're going to the next beautiful cycle in our life about perimenopause and menopause. So again, we have Dr. Jess here. And I would just love for people to hear what has made you so passionate? I heard you say earlier you're really passionate about this topic. What has made you so passionate about it, and why do you think this is important for us to talk about today?
Sure, absolutely. I mean, I think gynecology in general is just the perfect specialty. It's so rewarding because you can take care of a woman throughout pretty much all phases of life, from before they start the period, through fertility window, through perimenopause and menopause stages in life. And so I, in particular, see a lot of older women because I subspecialize in cancer and suspected cancer diagnoses. And so I am often helping a lot of my older women navigate this space. Cancer aside, every woman is dealing with some sort of version of this. And I think that empowering women to talk about it, to really bring their symptoms to light, to give them power and validate that they are not alone in their suffering, and offer them some relief, of which they're always so grateful to hear that there are solutions for some of the things that they're dealing with on a day-to-day basis. So,
Yeah, I think that's so powerful. And especially for you to have experienced so many women who are going through this, and knowing that this is not just a physical experience, but this is emotional and mental experience. And
absolutely.
so I'm glad that you're able to tackle it in all the ways.
Yeah.
And so I want to just like highlight some of the things I think that Dr. Jess is going to cover for us is first, what is perimenopause? Breaking it down, figuring out what this is. Talking about the spectrum of symptoms and what you'll experience, and then going into an individualized approach to therapy. So, what works for you to navigate it? And then, four, just feeling good and thriving in this. And so, I want to kind of back up to everyone and let's ask our opening question. And you can either answer in the chat or you can answer aloud. We'd love to hear your feedback. So, how has your family, social groups, maybe even media or social media depicted perimenopause or menopause? And how do you think that impacts your knowledge and or comfort about the topic?
I can speak. It's either from, I feel like from TV and movies, it's just like the worst thing ever and like very exaggerated and the end of, the end with the hot flashes, it's just like, oh no, it's over. And then I would actually say, at least in my family, like not talked about. Like it's kind of just like it was always like looked over. And I come from a big family with like aunts, and it just wasn't something that was ever really discussed. And I feel now, like with social media, it's like everything on my feeds are perimenopause, and then when I've had these conversations with friends, it's like, oh yeah, did you ever hear about this? Like no one ever talks about this. So yeah, I think my experience has just been like avoid avoidance and not talk publicly.
I think our
Yeah,
generation in
So
general is also just much more vocal about health and wellness than previous generations have been. And I think that's definitely going to be for the good. It's going to shed a lot of light onto issues. It's also going to open up other treatment options as well, and marketing and development when we start speaking out as women to be like, hey, we are suffering from these types of things, and there should be better options for us out there than what we currently have.
absolutely. Miranda, I think you were going to say something. What do you want to share?
I was gonna kind of agree with Elizabeth there. Social media. Back in the day, I remember like watching movies and like women were going through the change, and it was like that's
Yeah,
the end, almost like the end of your womanhood, and you
correct.
almost
Yeah.
feel like you just kind of wither away and die because like your hormones disappear, and you hear throughout your whole prepubescent, and then when you're going through your period, your hormones are basically what keeps you alive, and that's what makes you quote unquote a woman. And then when you hear that, when you start going through the change, they disappear. You're like, well then, like you start growing facial hair, and your body starts doing weird things. And in my family, my family's a medical family, so my mother was always very open and vocal about going through the change and like what that means. And now that I'm in that part of my life, she's been very helpful, as far as like creams and don't take this, stay away from that,
Yeah,
um
fantastic.
and been very very knowledgeable as far as like homeopathic things and things that I can eat and kind of help myself not have such a drastic change or a drastic menopausal phase. So I'm very thankful for that. But yeah, I will say nowadays in my algorithm, it's like perimenopause this, perimenopause that. And I'm like, is it
Of
because
course.
they know that I'm going through that? Or is it just the generational, like everyone now is more open to talk about it? Like you said, it's not one of those things we don't discuss because, women just used to go through the change silently and then suffer. And then when it was over, it was over. So I'm very happy about that.
I'm happy about that too. And I'm happy that you have such familial support around going through those stages. I think that's probably a big protective factor. I'm sure Dr. Jess, it's something that's probably going to come up in this approach in therapy of like what works for you is just having
Oh,
a
yeah,
good village.
for
Even Elizabeth
sure.
talking about her friends talking about it, that it's not this taboo thing, but it's just like all of us are like, what's going on together. So I love that. So Dr.
I
Jess,
love anecdotal things too. Like
me
you
too.
chime in if you have things, the little pearls that you have found that have worked for you. I have women come into my clinic all the time that are like, "What do you think about this? I got this supplement," and we go through the ingredients and we talk about it and make sure that it's not anything that's going to put them in danger, but otherwise, if it makes them feel good, then great type of thing. So we'll talk about a lot of that.
Good. Well, we'll go ahead and transition into you. If you wanted to share just some opening things of what is perimenopause and what are some symptoms that we may see come up.
Sure, absolutely. I'll share my slides. Wait, where did it go? I did this before. My big share button's gone. Oh, there it goes. All right. There's my picture. These are the breakdown of what we're going to be going through that April kind of already went through. So let's start with the basics. What is menopause anyway? And we're going to break it down. It is broken up into three phases. We have perimenopause, we have menopause, and then we got postmenopause. And this is all a very fluid thing. One kind of blends into the next one, blends into the next one. Perimenopause typically starts in your 40s, but it can start earlier. I will say, just as a global statement for menopause, it tends to be very genetic. So if you have a very open family and you have older sisters, mom, grandmas, aunts, talk to them about their experience with menopause because often you will find that they are similar journeys within families. Age of onset, age when your periods stop, symptoms afterwards, that type of thing. There are things that can cause some variability, but we'll talk about that. So perimenopause typically starts in your early 40s, but can start earlier. And this is everything about menopause is all based off the ovary. Your ovary are your factories of hormone production. And as we age, the factory starts to decline in its functionability. And so this is a gradual tapering off of estrogen production, and then all of the sequelae of menopause are typically a relation of that. Once we get to actual menopause, this is when you have gone a full consecutive 12 months without a menstrual period. Or I have a lot of women come into the clinic and they want to know their numbers. They want to be empowered with where am I in my transition? Is there any labs that you can draw for me that would tell me if I'm in menopause or not in menopause? And so I say, sure, we can draw an estradiol or estrogen level, and then this FSH level. And that's a hormone made by the brain. And it typically is in this feedback loop that if you're making lots of estrogen, then the factory can shut down up here. But if you're not making a lot of estrogen at all in the ovaries, then the factory is kind of working overload, trying to make your ovaries make more estrogen, but doesn't know that it can't. So this FSH level is a hormone made by your brain, and it typically is elevated way over 40. And that is how we can biochemically diagnose menopause from a provider perspective. On a national average in the US, the age is 51, but it can vary. And so I tell anybody plus or minus 5 years around that, typically. But you have the random person that comes in and say, I was 58. Okay, great. That's just your body, and everybody's unique. So this is when pretty much all hormone production has sufficiently turned off. Estradiol levels in the blood are typically undetectable. And therefore, you no longer ovulate, you're not having menstrual cycles, you're no longer fertile. Backing up to perimenopause, I do want to make the comment that as long as you are having a menstrual cycle, you can get pregnant. Women forget this sometimes and they think, I'm done having kids and I'm really not trying. Well, if you're not trying, then you're trying. So if you're not in some form of birth control, you can get pregnant at 48. So just keep that in mind. You don't ovulate every cycle when you're in the perimenopausal transition, but you will occasionally ovulate and you can get pregnant. Postmenopause begins the year after your final menstrual cycle and then continues on for the rest of your life. So a lot of statements I have, questions that I have from patients is, is menopause over? Well, not really. This is just kind of now an endless continuum of your current state of well-being. And I kind of phase it that way. This is you now with no more estrogen production, and you're still a woman. And then we talk about, are you having any symptoms of lack of estrogen? So I'll pause kind of there, and then we can kind of go into symptoms probably next.
So I have a question. This
Yes.
is random but not random. So for instance, like I have an IUD.
Okay.
I'm on the Mirena.
Okay.
I haven't had a cycle in what? God, my son is 17.
However long it's been in.
17 years, I think. So how does that directly affect? I know my egg still technically releases. So how would I don't have a menstrual cycle, so I would never really know what, like, when I would go like fully into menopause.
That is an excellent question. You would basically rely then on symptoms of perimenopause, hot flashes, night sweats, and all the other things that we're going to go into. So you'd have to base it on something other than bleeding. And
all the things that I'm going through now. Okay, thanks.
Yeah. But honestly, just for your perspective, and we'll go into this as well, perimenopause can be associated with a lot of unpredictable bleeding. And so a Mirena is actually a beautiful way to avoid all of that. And so, my advice would be just to ride that out until you know that you're well through menopause. Don't try to pull it out at 49. You may not be there yet, and you may all of a sudden have some unpredictable bleeding, but you can ride that out until like 52, and then pull it out, and you'll be in menopause probably by then. Just based on your family, average age of your family, and that'll be a really nice transition for you.
Yes.
That's so informative. Just never knew that. That's so helpful.
Yeah, and a Mirena IUD is, in my unbiased opinion, also, I don't have any financial disclosures. I'm not paid by any of these companies. I don't get any kickbacks. Anyway, because I'm going to talk about a lot of drugs probably in this talk, so I don't have any ins with any of these places. But Mirena IUDs is one of the best inventions. It has progesterone embedded onto the little T device, and so it slowly secretes progesterone into your uterine cavity, and it keeps your lining super thin, so you have little to no period. And it's very effective for birth control, but it also doesn't really give you the systemic side effect of birth control. And so it's often an excellent option for patients that don't really do well with birth control pills or the Nexplanon or the ring. So all of those are systemically absorbed. So for women that can't or don't want to expose themselves to systemic hormones, it's a really nice option. and it's for bleeding, abnormal bleeding, fibroids, endometriosis, chronic pelvic pain, and birth control. So that was a nice segue. Anybody else have any other questions?
Yeah, I was just gonna say I'm really ready to hear these symptoms so you can figure
Okay.
out you got the next steps of things to look for.
Yeah. Yeah. So we kind of alluded to this already. So what to expect in the perimenopausal transition? Oftentimes, as that estrogen starts to taper off, you're not going to reliably have ovulation. And so in my last talk, I kind of went through the menstrual cycle as a brief overview. And so it takes a very specific upswing and downfall of your hormone fluctuation in your cycle to trigger ovulation and then therefore a bleed afterwards. If you don't have that because your ovaries are not capable of making that anymore, you may not ovulate each cycle, which then corresponds to potentially an unpredictable shed of your lining, meaning you may not get a complete shed. So then halfway through the next month, you might spot, or you skip a period altogether because your hormone levels didn't climb enough to make enough of a lining, or you didn't ovulate, and so it didn't even trigger you to shed. And then you build up, and then the next month you have twice as thick of a lining, and then you get a huge gush of bleeding at the end of that month. So perimenopause menstrual cycles become quite irregular. Some get longer, some get shorter, some get heavier, definitely irregular. And then you start to experience some of those symptoms of the drop in estrogen, which are the hot flashes and the night sweats, which corresponds then to sleep disturbances, mood swings, and some vaginal dryness. And that will ramp up typically until we reach menopause, in which factories are shut down, estrogen levels drop, and then all of the symptoms that you were previously having typically intensify. And then postmenopause, over time, the body kind of adjusts to this new natural sense of being, and the symptoms do tend to taper over time. That also is kind of genetic. I have had women that have little to no symptoms. I have women that had symptoms terrible for 2 years, and I have women that are still flashing at 75, and we're still trying to manage it. So it's kind of across the board. And then when we talk about postmenopause, we talk not only of the symptoms and symptoms management, but we also talk about some of the other things that you alluded to, which are what are the overall risk factors long-term for me not having estrogen on board anymore, which are some of the ones that I listed there: osteoporosis or weak bones, heart disease, because estrogen is very protective for a woman's heart. And that's why men get heart disease in their 50s, but women typically don't get heart disease start to accumulate until they're like their 60s, because we have the estrogen on board as a buffer. And then urinary symptoms and pelvic floor prolapse and those types of things also can happen over time in the postmenopausal period from a lack of estrogen in the vaginal area. And I think I'll pause there.
This is so good, so helpful. Um, I have a couple of questions myself, and let's see if anybody else is able to give towards this. I think there's a lot of, I don't know if you've heard them, but I've heard a lot of myths around just perimenopause into menopause of, if you have a certain amount of kids, you could knock yourself into menopause earlier or later. Or, if you, I don't know, just, these different things we say that like if you do this, or if you take these certain supplements, or if you have like this much weight on you, if you have your last kid or first kid at 35, is there any truth to around those things, or are there certain things that you can kind of contribute to that? Maybe even how heavy or light your cycle is, or how your pregnancies were. How does that impact menopause, if it impacts it at all?
Sure. Those are actually all myths. The
Okay.
only things that I can think of that are known to shorten your Lifespan of reproductive fertility and estrogen are smoking,
Okay.
leads to premature menopause, and typically worse symptoms, more severe symptoms. Um, the any exposure obviously to chemo or radiation will cause damage to the ovaries, which can increase their early shutdown. Endometriosis does cause chronic inflammation to the ovaries oftentimes, so that may have a correlation as well. And then the only other one that I can think of is when you have a genetic mutation, like the BRCA gene,
Mhm.
which predisposes you to ovarian cancer.
Mhm.
Those women typically have issues with fertility and early menopause.
Okay.
Those are the only ones that I know of. There are some like old wives' tales out there, which do have some truth to them in that your BMI actually will correspond to the severity of your symptoms. And that can be explained physiologically. Um, when a woman carries extra weight, there are still some hormones that are non-estrogen hormones that are made in your adrenal glands, even
Mhm.
after your ovaries have shut down. In a fat cell, adipose cell, there is an enzyme that will take those non-estrogen hormones and convert them into estrogen-like hormones. And so
Mhm.
therefore women that are overweight almost have a natural estrogen buffer, and therefore they have more mild symptoms
Mhm.
than an underweight woman would have more severe symptoms. So there is some truth to that.
Mm. Finally, my high BMI can work in my favor. Wow.
Exercise improves symptoms as well. But
Agreed.
we'll get into that here.
Okay.
What else?
Yes, Miranda, we're on the same page. That's helpful. Yes, look at all of us. I think that's a really, really helpful information. As someone I'm 32, so I have not got to that place yet, but
Yeah.
I do have a lot of older friends and I'm seeing them like look at the horizon and I'm like, what is it? And so, the only experience I ever had was my grandma. I just remember at one time she was like, yeah, I'm going through menopause, and everyone's like, oh, and it's like the shudder feeling. I was like, oh man, like don't go over there. And then just one time of my doctor bringing it up of like, yeah, like you want to get all this stuff together before you get in menopause, and then it's downhill from there. And so I just wonder if anyone else has ever had just any conversation at all with their health professional about menopause or perimenopause? And if so, like, has it been a positive experience or has it been just like, ooh, that wasn't really helpful?
Okay, so before I jump on this work call real quick, I have to tell you this hilarious story. So I went to go see my OBGYN. This was maybe about a month ago because I started having like really bad vaginal itching. And I was like, I have this dormant STD that's been laying dormant for like years because I get tested regularly, but I was like, what the heck is this? So I went to my OBGYN, which I've known for years, and I was like, what is happening? And then come to find out, she was like, girl, you're just going through, you're in the perimenopause phase. She was like, welcome to vaginal dryness. And I was like, I don't like this. I'm not ready for this. This is not happening to me. I was like, I'm only 43. And she was like, you're in the age range. And I was like, wait, no. Yeah, but she was like, just figure out, you look online and see if you can find some probiotics or some pills to help with, the vaginal dryness. She was like, welcome, because she's 50. So she was like, welcome to the club. And I was like, I'm not ready. I'm not. And then it was
Oh,
like, it became like an onslaught because like after I had that, then I started having the night sweats. Then I had my first
yeah.
hot flash. And then I was like, it's like she
Yeah.
basically like unleashed the Kraken and like everything started happening at once. And I was like, oh no,
Well,
really?
if you're a fan of like naturopathic and holistic, I know you have to leave, so
Yeah.
I'll skip to the good
I'll still
part.
be here. I just won't be as interactive, but I'll still be
Yeah.
like
Um,
listening.
the check out the company Bonafide,
Okay,
Bonafide.
see, I've seen those. I've seen them
Yeah.
online. So like now it's like more of like the I guess, which there's so many out there now. Now that it's not it's not like a taboo subject. There's so many different brands out
Yeah.
there. So now it's like, which one is actually the most
Yeah.
beneficial at this
Those
point
ones
is what I'm
have
like. Now
those
I'm
ones have
almost like
some
being
pretty,
on like
yeah.
overloaded with
Yeah.
things.
Those ones have some pretty sound clinical data. And so I'll and like I said, I don't have any kickback from this, but I do often send my patients that way. And hers, the website, I was checking out hers while I was preparing this lecture. They actually have some pretty great options too in terms of like libido and vaginal health and that type of thing. So with that segue, I think let's
Well, thank
get
you guys. I'll still be here. I just won't be as interactive, but I'm still going to
okay.
be on the call. All right.
Perfect.
Darlene, were you going to say something or do you want us to keep on going?
Yes. I don't know if we'll talk about this later, but I have to make sure I bring it up.
Yeah.
So I had to go to urgent care because I got a UTI, and the doctor came in after confirming with the tests, and the first thing he said was, "Have you gotten a UTI often?" And when was the last time you got one? I was like, "It's been probably over 20 years since I got a UTI." And he
Yeah.
was like, "Well, looking at your age, you're going to be getting them possibly more often now." And he went on to explain because you get
Hmm.
vaginal dryness and then the bacteria in your vagina changes. And so to not be surprised if I do get another one, but it could be tied into, and that's the first time I've ever heard that. So again, it was one of those, aha, there's something else I don't know.
Yep.
So it was another thing. I'm like, oh, I didn't know I was gonna experience that. I would have been drinking my cranberry juice on the daily.
Yes. Yeah. And we'll talk about that a little more, but yes, that is 100% a real thing. And why I actually advocate for pretty much 100% of my patients past a certain age to use vaginal estrogen cream. Um, and so we'll talk about that. Gotta get to my favorite slide, the glow up. All right. So these are some fuller slides, but mostly just so that the viewers and future viewers and readers have kind of a comprehensive list. I'm not going to read it all to you, but the mainstay of treatment of the hot flashes and the night sweats, in no particular order. First of all, is just to know that that is what you are experiencing. If you've not yet experienced one, it is as if an internal furnace has turned on from your core and then takes over your whole body, and you feel like you have 120-degree fever, and then you sweat. Um, and it's usually transient, and it varies. You can get it 20 a day, you can get 10 at night, or you can just get them on very rare occasion. Everyone's different. Can you also hear me? Can I hear you? Okay, good. Um, and so lifestyle modifications are kind of the first thing. Get yourself a fan, a ceiling fan. You may need to get different sheets that are a little bit more breathable. You may have to layer clothing so that you can take things off. Caffeine and alcohol and smoking all worsen your hot flashes, so try to avoid those or use them in very moderation. Then there's some non-hormonal supplements and non-hormonal medications, and then hormonal medications that can be used. And so the spiel that I typically give my patients is, if you're not one that wants to take a prescription medication, that is totally fine. There are some non-hormonal supplements out there, like black cohosh has excellent data. You just have to make sure that you ask your doctor and your pharmacist If there are any medications that interact with black cohosh, some of like the blood thinners can. So you have to just make sure that that's not the case. The supplements that I previously mentioned from the company Bonafide, of which they have one that's called Relizin, that helps with hot flashes. There's also another one called Evening Primrose Oil, which sounds exotic, but it also has some pretty good data in terms of a non-hormonal supplemental option. Then there's the non-hormonal prescription options, and this is for women that are like, no, absolutely not. I am not taking hormones. I've heard all the horror stories about the risks of hormones, and I will not take them, but I need something. Or my patient population, a lot of them with cancer cannot take hormones because of that previous history. And so we have to rely on this limited list of medications. So there are 3 actually FDA approved medications for the treatment of hot flashes. One is the paroxetine or Paxil, which they label under a different name called Brisdel, because they wanted to make it brand name again so they could charge more, even though it's the same drug. You know how that is. Venlafaxine, which is brand name Effexor, very effective, once a day medicine. And then there's a new sexy drug on the market, still brand name, so it's expensive and hard to get, but it's called Veoza. And you may have seen TV commercials about Veoza. For the patients that I can get on Veoza, typically you have to like fail one of the other ones first before you can get a prior auth to get Veoza. So there are some hoops that you have to jump through, but you just have to be persistent about it. That one actually is very effective. And the way that these medications work are similar actually to their antidepressants by previous design, but by changing the dose and modulating the dose, it works on the serotonin receptors in your body. So it helps regulate your internal thermostat. And those are how those work. And they have been studied in trials where they go head to head against estrogen and seem to perform as well. So it's not like you're getting second tier medicine by choosing these and doing the non-hormonal route, because you can still get as much efficacy from them. And then the hormonal therapy is exactly that. There's estrogen, and then there's estrogen with progesterone. And I'll shout this from the rooftops as the cancer doctor. If you have a uterus still in your body, you have to take estrogen and progesterone. You have to have the yang to the yang. Because if you take estrogen alone, it will stimulate the endometrial lining to start regrowing again, which is not something that you want in menopause. And it can lead to endometrial polyps, hyperplasia, and cancer. And so if you have a uterus, you have to take the combo. If you're already previously had a hysterectomy, plus or minus ovaries, they don't matter. If the uterus is out, you can just take estrogen by itself. And there's a lot of myths out in the world, which we'll myth bust a little bit here, about bioidentical hormones. And I won't spend too much time on this, but the prescription medicines that you can get from a physician or a provider are bioidentical already. Estradiol in a pill or patch form or a vaginal ring form, estradiol is bioidentical. So when you go down the route of searching for bioidentical hormones, it'll typically be by someone who makes you pay cash for the word bioidentical hormones for no reason. And bioidentical hormones are usually compounded. They're not FDA regulated. Therefore, they're not tested. You don't know if the doses are consistent, and they may have side effects that you don't know about. They may be putting you at undue risk that you don't know about. So I will say that about bioidentical hormones. And the same also goes for pellets. I'm not a huge proponent of pellets. I've seen way too many pellets result in cancer. So I do not encourage any of my patients usually to go through pellet therapy. I've also heard great success stories about women's lives that were changed with pellets. And I don't discount that, but it has to be done in a very safe, very controlled fashion, and not everyone can be a pellet provider. So I would just be on, be very educated about that if that's the route that you're going to go. Sleep disturbances, we kind of already talked about. Sleep hygiene is probably one of the best ones. Avoiding caffeine and alcohol before bedtime. Get yourself on an actual sleep schedule. Avoid your screen time while you're in bed. Get yourself a ceiling fan, new sheets, light clothing. And then for your vagina area down there, to not sleep with anything on under there is also very healthy, to let her breathe. In terms of medications to help with sleep, I try to discourage the sleep aids like Ambien and Xanax and all those types of things, because those are short term, they're benzos, they're addicting. But natural things like herbal teas, melatonin, maybe, like some meditation or yoga, those types of things at bedtime are very helpful. You want to try to avoid the sleep aids as much as possible because they're just for short term. The mood irritability is a real thing, and you're also it's such a hormonal change, but it's also kind of an identity change. Your body's going through so much. Similar, I mean, your body goes through this same phase as postpartum. Postpartum, after the baby delivers and your placenta comes out, your hormones plummet. So that is like a taste of menopause in an abbreviated version. And so the waves of emotions and irritability, crying, all those things can be experienced in menopause. But therapy, identifying your triggers, knowing how to cope with those feelings, helping your family around you to understand what you're going through, taking a DivaDance class or doing an Inspire and Build, and really tuning into your own mental health and mindfulness and going within, searching within and finding your happiness. That's work, that's not something that can just be fixed with a pill. Obviously, I put in antidepressants, but it's, like I said before, postmenopause is for the rest of your life. It's a whole new phase, and it's not something that you necessarily want to take an antidepressant for the rest of your life. So you just have to learn the new you in this phase. Brain fog is a real thing, and vitamin D is actually the most important thing for brain fog and cognitive function, as well as your brain also needs exercise. And so doing like tasks like Sudoku puzzles or other things like that kind of stimulate your brain, are actually really helpful to combat brain fog. And exercise and adequate sleep, obviously. And then getting to the vaginal dryness. It can happen as early as perimenopause, like Miranda was saying, and it will continue on. And unlike some of the other symptoms, which will get better or will get worse and then gradually taper, this only has the potential to get worse with time. And so this is something that I try to hit hard in the late 40s, early 50s of this is a reality. Your vagina is lacking estrogen. You are going to get dry. You could get narrower. You could get shorter. Sex will become more painful. You will avoid that sex, therefore, because you can already anticipate the pain. And then the imbalance between the good and bad bacteria. Lactobacillus is our good one, right? That's the one that's in all of the probiotics. that we want to optimize. But lactobacillus actually requires estrogen to thrive. And so when you lose the estrogen, the lactobacillus kind of fade away. And then that gives room for all the other bacteria that actually still exist in your vagina, but they're all kind of in harmony, when estrogen's on board, because the lactobacillus keeps everything very acidic, like we talked about last time. But once the acid fades away, then you start getting E. coli and Klebsiella and Proteus, all these bad bacteria that all our holes are very close together down there. So it's very easy to get UTI. And so the name of the game with this, I mean, you can use all the natural lubricants, you can get the hyaluronic acid inserts, and all of those are great in terms of supplementation and helping with sex being a little bit more comfortable. There's really not any, what I'm trying to say, replacement for replacing the estrogen itself. And so a vaginal estrogen cream or a VagiFem insert is life-changing. And I've seen it a million times at this point in my career, that just doing that, putting that amount of cream in the vagina twice a week at bedtime, put it in there, sleep, let it do its thing. It will bring back the natural lubrication. It will reestablish your flora. It will decrease the number of UTIs you get in a year. It will make sex enjoyable. It will also improve the collagen. Estrogen is essential for collagen production. We all know about collagen, right? All of our wrinkles and sagging and all that. So the same thing down there. Collagen stimulates good tone of our tissue down there, so less likely to get prolapse, laxity down there, and less likely to have urinary incontinence for the same reason. You add a little collagen to your sphincter, you're not going to leak as much. So that's kind of like one of the first treatments we do for women that are leaking is, I have a list of 15 medications I can put you on, or we can try estrogen and you do some Kegel exercises, and most of women will actually improve and reverse their urinary incontinence without having to take any meds or have any procedures. So this is like the creme de la creme of all the things that I'll talk about is estrogen, vaginal estrogen cream is the best thing to do, and it's safe. Everyone can do it. Even if you have all the contraindications to estrogen, history of cancer, heart disease, stroke, history of blood clots, all those things, there's not enough estrogen in a vaginal estrogen cream to get absorbed systemically. So it doesn't put you at risk. It's like you're not even on a hormone. It's just for your vagina. And I think that's the end of my soapbox about vaginal estrogen. And the last thing is your bones. And the two best things that you can do for your bones are optimizing your calcium and vitamin D and doing weight-bearing exercise. You can do all the cardio you want for your heart health. You have to do weight training for your bones. And that is the end, other than my public service announcement. But we'll stop there for a moment, do a segue.
This was, again, just so informative. I'm seeing all the nodding heads that like this is so informative. I think because it just feels like we all just kind of said, it just feels like the end. And you're like, oh well, my body's just jumping off the cliff. So I'm really glad that you went through each symptom and gave so many options on how to just even work with it or to combat it. And everything wasn't just about medicine. Some things were just about lifestyle changes and practices.
Yep.
So that's awesome. That's so comforting to know that there's so many things we can do and so many levels of things we can do and combine together that would just help people feel empowered to navigate through it.
Of
I
course.
know it's just it's extra steps, but to know that the steps are there is exciting.
This is inevitable. Everybody's going to go through it. But as long as you kind of identify,
Hmm.
embrace, and educate yourself
Hmm.
on that you're not in this alone, that there are lifelines out there for you, no matter what symptom you're experiencing. Um, don't suffer in silence and just reach out.
Absolutely. I'm ready to hear this public service announcement.
Oh,
I'm
all right.
like,
Public
I'm
service announcement
invested.
is June is Uterine Cancer Awareness Month. And so I thought that mentioning it here is not only timely, but also appropriate for the topic that we are talking about today, which is menopause. Uterine cancer typically affects women in their menopausal years. And some of the symptoms that I talked about earlier actually can be the first early signs of uterine cancer. And so I often have women come in that have been diagnosed with this and they're like, I just didn't think that anything bad was going on. And the number one thing is I never stopped having my period. They kept telling me that I was gonna stop and I just never stopped. And maybe I'm just still having my period. I'm like, ma'am, you are 62. That is not a thing. You have to just know some basic information, and that's why I wanted you guys to all know what is the average age, what is falls in within the norm, what is in the spectrum of normal, what should I expect and what should I not expect. So uterine cancer, if you have any of these risk factors, of any bleeding after a menopausal age is a red flag. Doesn't mean that it's cancer, but it's cancer until proven otherwise, is what I say. If you have very irregular bleeding in women younger than menopause, from all the way down into the 30s through the 40s, if you're having consistent irregular bleeding, that could be just normal for perimenopause, but it also should be talked about with your provider because there are some evaluation tests and things that can be done to make sure that you're not falling outside of the realm of normal. Um, because as we say, when you're having, when you're not ovulating each month and you're growing that lining thicker and thicker and thicker, that's when bad things can eventually happen with the cells in there and they can turn to precancer and eventually into cancer. So that's kind of what I wanted to just touch on was if you're having unpredictable bleeding or any bleeding after menopause, that has to be checked out immediately because as soon as you identify it, as soon as we can make the diagnosis, early detection will save lives. Stage 1 endometrial cancer is curable with a hysterectomy. And so if you say nothing and bleed for 6 months to a year before you get checked out, then it may be too late. And then you're talking about chemo and radiation and higher risk for recurrence. So we talked about before women that carry extra weight, that peripheral conversion to estrogen. I would say 95% of the women that I treat for endometrial cancer are overweight for that reason. In menopause, you should have complete shutdown of estrogen. You should have no estrogen stimulation to the uterus unless you're taking hormone replacement therapy and you're countering it with progesterone. You should really have no estrogen exposure to your uterus. And so women that carry extra weight are getting that indirect conversion, right, through their fat cells. And over time, that can turn into precancer and cancer. And then they can start manifesting with bleeding, get polyps, and then if ignored, then it turns into cancer. So obesity is a risk factor, and that is why out of all the cancers that we treat, men and women in this country, endometrial cancer is the only one that's increasing in incidence and mortality. Let that soak in for a minute. We are winning most cancer battles in terms of, pushing survival and pushing prognosis and new drugs and all these things, and we're making headway in the survival of all other cancer types except for this one is getting worse. And it directly correlates to the obesity pandemic of this country. And the diet and all of the artificial hormones and things that are getting added to our food are all contributing to the increased incidence of endometrial cancer. So talk to your family members, talk to all the women, make sure that they're doing hormone replacement therapy safely, make sure that they're not ignoring any bleeding symptoms.
Oh, that is definitely very informational, helpful to know for
Yes.
sure. Thinking about all those things to look out for. Any thoughts? Anything, any reflections, or anything to learn?
I would just say that, kind of from the beginning of the conversation, I think it's just so important that we like have these spaces to talk about these things and for like friends to start sharing more and more. And I'm glad that it's becoming less and less of a taboo
Mhm.
topic because I just, as with everything, the more we share, the more we know that we're kind of all going through this, especially since like half the population is going through this. Like we should be, it shouldn't be stigmatized. And even, I know it's really hard for women to be heard. I know especially for women of color, but in the medical field, you go to your doctor whether they're male or female, and they're just kind of like, oh, well, like, oh, like kind of how they told Miranda, like, yep, buckle up. And it's like, why are we supposed to suffer? Like, can we do something to make us, feel a little bit better?
Right.
So I feel like, yeah, that advocacy is so important, but I think all the information you just provided gives us the tools to do that. Because I think
Yeah.
a lot of us go in being like, something feels off, but I'm not sure. And then they say, okay, we'll track it for the next 3 months. And you're just like,
Right.
what do I do? Yeah.
Yeah.
So
Yep.
thank you.
And so knowledge is power, and like I said in the last webinar, it's a team effort. You and your healthcare provider, more than ever, it's not really this paternalistic, the doctor tells you what to do, he orders the test, and then you're on your way, we'll see you in a year type of thing. It's really a relationship, and if you don't have a good one with your provider, then it's time for you to find another one. You need to have a really good working relationship with your provider so that you feel heard and that you know that you leave that appointment exploring all options and really improving your quality of life. Because that's what it's about.
Agreed. Agreed. So, Dr. Jess, what would you suggest after receiving this information, especially in the physical ways to combat it? What are some ways that we can still like feel empowered and feel affirmed in this? Because sometimes you can hear this and be like, whew, this is like the worst time ever. What are some things in practice we can do to feel good about this season of our life?
Absolutely. I think it's not just in this phase in your life, it's at every point in your life to just love your body and pay attention to your body. It's telling you things every day, the things that it needs, how it how, when you do the right things, how good it makes your body feel. And really start to hone in and pay attention and journal or do a log of the things that make you feel good, and already be preemptive, like you just said, track it for 3 months. Okay, well, I actually already did that, thank you very much, and this is what I have to show you, and these are the
Mhm.
symptoms that I'm having. So just empower yourself with self-reflection so that you can hone in on what are your most important objectives with this appointment that you're having today. Is it, I mean, vaginal dryness might not bother you, but only getting 2 hours of sleep at night because you sweat through your sheets 3 times and change your clothes twice, or you got up 4 times to pee in the night, like those are the types of things that you want to mention so that you can get help.
Agreed. That's so helpful. Does anyone else have any thoughts? I think, Darlene, do you have something you want to share?
Yeah, yes, I'm like I said, I'm 3 months away from my year, and watch me get my period like that last month.
Yeah.
But what I'm going through right now is I feel like everything is happening all at once. Like I'm having a lot of other health issues, and so I don't know, is this related to menopause? I've been reading, and it's always that, well, it could be, well, it might be, well, it's not certain. The research
Hmm.
isn't there. I've been having skin issues for about a year. I have like this dermatitis thing that started in my eyes and it's now in my neck. Now I have dry eye. I'm getting a colonoscopy on Thursday. I feel that there's now these medical issues that have been popping up, and I feel it's all happening all at once. And my question's always, well, is this
And a
related to
coincidence.
menopause? Is this
Yeah.
perimenopause? What
Yeah.
is? And ironically, my actual perimenopausal symptoms aren't as bad. I'm extremely tolerant of heat. So, yeah, I can feel the hot flash coming on. I'll just like throw the blanket off. Okay, it's done. I don't perspire, so I'm not like sweating through the sheets or anything like that.
Hmm.
But and then I don't, my brain fog is definitely a thing, but I feel like I've had that since having my kids too. And there was postpartum depression there as well,
Sure.
um, that sometimes I still get. So now bumping the postpart because I'm 53, so I had my kids at 38 and 40. So
Hmm.
I have a 12-year-old, I have a 14-year-old. So I feel like my postpartum depression is almost like sometimes bumping into my perimenopause.
Sure.
So there's like a lot going on. And when going to all of these doctors and specialists, they're like, no, 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 it's not related. No, well, no, 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 it's not this, it's not that. Let's try to find what it is. Like, but I have tried to do some research, and again, there's not conclusive, like supportive evidence, but it's possible it could be.
Sure.
So
Yeah.
that's where I feel like I'm in like limbo. Is this
Sure.
menopause related or is it a
A
separate
lot of, yeah, a lot
medical?
of skin changes are hormonal, so that makes sense to me a lot. That would be one of the first things that I would look at for you would be, I'd dive further into the symptomatology that you're having and could it be an autoimmune type of disease? I'm sure that's the route they're also exploring. In females in your age group, they can also manifest at this age too. So
Oh.
autoimmune disease like Sjogren's or psoriasis and those types of things can also manifest. And so, having an endocrine type workup or rheumatological workup would be something that I would recommend for you, just to rule out anything that would be potentially bad or harmful to the rest of your health. And as long as that was not there, then you can always circle back to, well, maybe if I try a low dose hormone, maybe I would see significant improvement in my symptoms, and that could be always something that you could think about.
Hmm. 'Cause I went to a dermatologist and they wanted to do this extensive testing, and come to find out that my insurance actually doesn't cover it. So I would have to pay $580 out of pocket to do this allergy testing. Um,
What are the
yeah.
chances that at 53 you've become allergic to something?
Well, actually, I think once I turned 40, I started getting seasonal allergies that I hadn't had before. And then 50s, it's kind of like gotten worse then. So, I mean, I don't know that's the thing. And the dermatologist actually said it's possible that a combination of things can also cause it. So it's really hard to pinpoint it. That's why it was this like extensive um, allergy testing. So I had to go to the allergist, and he was like,
Mhm.
"Yeah, it's something like 200 different pricks on the back and all that stuff." Yes, yeah. But then, when they said $580, I'm like, I'm not gonna do that. I can't do that. So,
Sure.
um, I just feel like, okay, what's next? And then I had some other issues going on with, bowel movements, and now they want to do a colonoscopy because there was bleeding going on there. And so now I'm getting that done. And my last colonoscopy was clear. And they were like, yeah, it's because, when you turn 50, you have to start getting colonoscopies. And I
Mhm.
also had an endoscopy done because I have a hiatal hernia. So I have all kinds of things happening. I just feel like it's all happening all at once, and it weighs on you.
Sure,
So
of course. And then,
emotionally,
yeah, and
physically,
then it's your mental health because you're like, my gosh, I have all these appointments and I have all these
yeah,
tests and I have all these things wrong with me now. But the
yeah,
more you look, the more, the more the things that they're going to find that maybe you've been living with your whole life. And I mean, how long have you had a hiatal hernia? Probably since the birth of your last child.
yes,
They're going to do an endoscopy and they're going to find it. And then all of a sudden you have a new diagnosis. So,
yeah,
um, but the the GI bleeding definitely it requires a workup.
yes.
Just, hemorrhoids, or is it something more? So that's definitely something. Um,
So is that also part of it too? Like
GI
hemorrhoid?
bleeding has nothing to do with menopause, so that is not correlated at all. Hemorrhoids can come with age, but if you have a non-hemorrhoid cause of GI bleeding, it needs to be,
No, there's that too.
yeah,
So it's yeah, like everything is coming all at one time and
yeah.
happening. And hair is turning gray where you don't want hair to turn gray, and
Mm-hmm. Mm-hmm.
some places you can get rid of, and like your eyebrows, you just gotta keep covering them up and
Fair. If it's down there, then before it all turns gray, I would laser it because once you can't laser gray hair very well.
oh, good point. Good point. I don't have yeah,
You
it's
have
not
to have
like
dark hair
oh,
for a laser to work. So
that's right.
just
Yeah.
FYI.
It's all the things. It's all the things.
Yeah. Yeah. But keep track of because they're gonna start saying all these things, but really kind of just keep track of the things that are bothersome to you. And if at the end of the day all of the dangerous things are ruled out, then just circle back to what are some things that I can do that might make me feel better? Are there new, some new topical creams that I can do that makes my skin less irritated? A daily magnesium supplement is super helpful to keep your bowels regular. It is not a stimulant by any means, but um, hormones in general um, stimulate the motility of your gut. And so when you're lacking them, then sometimes things move a little bit slower through the tract. And so magnesium is a really good motility enhancer. And you have to drink lots of water, which will also maybe help some of your dry skin.
That too, but then we have the whole pelvic floor is not working as it used to, so it's harder to hold it
Mm-hmm.
in. And
Vaginal estrogen and Kegels.
yes,
I'm telling you, I I have to make people buy into that because it really is life changing. So,
You convinced
our
me.
prescription for the estrogen cream.
Yeah, it's really again, these are things that sound like they're really beneficial and really helpful. And again, I think the greatest first step is which has been done today is take off that stigma because then when we just go ahead and put the stigma down, we're more likely to have these conversations and we're more likely to be like, yeah, girl, I'm going to get my vaginal cream. Like it feels
Mhm.
normal versus like, ooh, like that's weird. What's wrong with you? But it's like,
Mhm.
no, this is part of our time. This is what we're doing. Let's all go
Mhm.
do Kegels together. There's this one
Yes.
woman that pops up. Don't know how she got in my algorithms, but she's like, okay, stop. And she does like the Kegel exercises. And I'm like, oh, shoot. Like
I
it's,
see her
it's
too, where she goes to
yes,
do like,
yes. And she stresses me out. I'm like, okay, I guess I have to do it. I feel pressured. But those things you buy into so that way at least you're putting in the practice and you're putting up like the
Yeah.
resourcing to make it
Yep.
happen. So that's really
And
helpful.
sooner is better than later on the Kegels.
Yes, yeah, I've heard that a lot too. I mean, I haven't had a child yet, and I feel like, let me go ahead and just get ahead of the game. So that's great. Well, any last thoughts, Dr. Jess? I mean, you've given us more than enough information today.
I am fresh out of thoughts at this point.
Well, you gave them all, and it was so helpful, so insightful. I think people that are in every stage of this, I think we have all learned something. We've all felt more equipped, more empowered. We're all going to go look for our creams, our exercises, our hormonal pills, whatever it is, we're ready. So thank you, Dr. Jess. Thank you so much for sharing your expertise. Thank you to everyone here participating for sharing your stories and sharing your experiences. That does not go unnoticed because that helps us all to grow when we're able to share our stories and know
Yeah.
that, okay, you know what, someone else is going through this. I don't feel it was weird. So I
Our
hope
guys
that
are
everyone's
comfortable
feeling
sharing
that
for sure.
oral health.
Mhm.
Yeah, for sure. And of course, we're always able to be reached. So if something came up for you and you're like, oh my gosh, I just want to share it, email us, send us a message, let us know so we can get you some more information soon. Um, but until then, thank you all again for tuning into this, whether you're live, whether you're listening back. We really appreciate your time. We hope that this has been very informative for you. I know it has been for me. Thank you again, Dr. Jess, for your time. And I hope that you all have a really amazing evening. Take care.